I'm Brad Hemminger, stuck a little bit with me, just been sitting for a while. I'm informally dressed, not because of disrespect for you guys, but because we just moved into a new house this week. All my clothes are in boxes, and I wasn't there when they loaded them. People put them all in the back closet. A limited wardrobe right now. I'm going to take a slightly different tack. What I'm going to try to do is to seed you guys kind of with some ideas, because I think the discussion part is going to be the most fruitful part of what we'll do today. But I really appreciate the lead-in, both in the curriculum and Debbie on the slides. I always tell people public health is populations of people, right? All you guys, but thousands and thousands, millions of people. We call biomedical or medical or health informatics is the body. That's what the physician works with. And then bioinformatics is microscopic. It's zoom all the way down to the small parts of the body. So just on scale. Lots of people, public health, all the rest is in the middle. Bioinformatics is genes and proteins and stuff like that. So I'm on the curriculum for the BCB, which is Bioinformatics and Computational Biology. I'm just going to tell you a little bit about that. I'm mostly going to just tell you about some projects that I've done research in. I think give you examples of how the library and kinds of people and skills can come into play in these types of areas. So bioinformatics, one of the big things is looking at sort of the genetics of what people how are comprised and stuff like that. It allows you to do what we call personalized or customized medicine. So you might take a drug that might react differently for you than it does for me. All right? We like to know who it's going to react differently for and give you the right choice. Okay? How many people have been curious and maybe had like a genetic test? Anybody? And did you get one of those that tells you about all the things you're potentially at risk for?
Yes.
Did you ask them to tell you everything, or did you say, don't tell me some of the things?
Everything. Before on the FDA.
So let me just ask you guys to raise, suppose you do a genetic test, and it's going to tell you about all diseases, and we only have a small piece right now. 10, 20 years from now, we'll tell you about the main diseases probably that you might have. Do you want to know about all the diseases you're at risk for? Raise your hand. You want to know everything. How many people want to know nothing? How many people are in the middle? You want me to know some. What do you want to know if you're in the sum? What kind of stuff do you want to know?
Ones I can do something about.
Yeah.
So that's about 90%. People think about it a little bit and say, do I really want to know I have maybe Huntington's or something that I can't fix, and I'm just going to stress about and worry about, but if I can fix it through diet or something like that, or some drug or therapy treatment, I probably want to know, right? So there's a lot of privacy, ethical issues involved, things that we need to help educate people about. I work a lot with breast cancer research. If you have women that have mammograms or things like that, if you go and find you got the BRCA gene or some indicator like that, should you have to tell your sister? Right? There's these privacy things. How much should you have to share? So I'm going to tell you about 5 or 6 kind of projects real quick that I've worked on. One was about personal health records, and this was, I just bought a pill box. If you're as old as me and you have trouble remembering to take all your vitamins and medications and stuff. And I remember this because my wife's mother, who's passed away, had a whole bunch of pills in her pill box, and we had to intervene at one stage because she had several things going on health-wise, and she had about 4 different specialists working with her. And the issue was communication. How did those people that were taking care of her, because she got to a state where she couldn't take care of herself and $2 for trying to take care of her, how did they communicate? How did they help share that information with these 4 or 5 specialists, the primary care physician, $2 for trying to manage her care in the different states? And so that's now with internet and communications and computers and things like that. So we built tools to help share the medication results. All right? We do a comparison of sort of these visual presentations and try to test which ones are better, which ones are worse. It turns out, like all good things, all tests, certain things are better for certain kinds of things. Pill boxes are a good kind of analogy for like a weekly thing to make sure you took your stuff. List is good for comprehensive. We have these bar charts that show you how you took things over time where interactions occurred. So if I thought I was sick, I could see which of the medications I took at the same time, keep notes and things like that. So that was helpful. Another project we did was young adult cancer survivors. This was Julie Blatt over in oncology. This is children that are teenagers transitioning to adults, and they've had parents help them care for them. And now they're going out to care for themselves, and they've been through a traumatic experience, and now they have to manage their life all by themselves, right? So it's two things. It's one is access to content. How do I know how to manage this better? But it's also connections to other people, right? So you look at how people use the internet is to look up information, is to be part of groups that have the same kind of experience as you, and to share and get support, and not just knowledge, but also emotional support, things like that, right? So some groups also look at those forums. We have a number of students at SILS looking at those kinds of things, support group forums, and how those help people. Debbie mentioned mobile. You mentioned all these great things at the same time. Mobile health, mHealth, we do a number of projects like that. RTI has been collaborating with us on some of those. So it might be you're diabetic, you've got some chronic condition, we want to encourage you to take your meds. How do we do that? How many people have a desktop computer? How many people have a laptop? How many people have a tablet? This is my freeway test. And how many of you have a cell phone? How many people have the cell phone with you more than all the rest of those devices? Okay, so that's why mobile health is an important thing, right? Because it can give you reminders. And we find people are searching out information on these much more frequently than they used to, and perhaps more than like your laptops or desktops. And especially if you go to other countries, if I go to Africa, way more use here because they don't have the other devices. So how do you do that? How do you give people alerts? How do you get people to do behavioral change? So a similar project to that, we have one for breast cancer, which is the Institute of Environmental Health. Breast cancer for young African American women. The content is we know the message we want to get out. You're actually at risk. You may not know you're at risk. We want to convey that. In certain kinds of cancer, you're more at risk if you're African American women. They have a lot more of these, and they do laptops and desktops and stuff. And so we've designed an interface to try to interact with them to convey that. And it's based on stories, video, and short messages, and kind of a quiz like you might see in Women's Health magazine. What's your breast health risk? And you click on these things, and it tells you if you have better diet or better this. And what it's trying to do is get you incentivized to say, hey, this would change your behavior, right? If I can get you to think about it, you might change your behavior. If you're just going to go read some boring article, you're not going to probably read it in the first place, let alone change your behavior. So that's an example of another one. Let's see. Science data repositories. I'm real big on open access, open science, things like that. And a lot of groups, Barry's been working on this same area with me for a long time, KT when she was here. Scientists on campus say, I've got this great stuff and I want to share it with the world. I want them to all know about this great research that we've got, or this repository. So a current example we've got also with Julie Blatt and colleagues in sort of chemical informatics is what they call a children's pharmacy. So it's a collection of all the drugs that are used on children and the reactions that they have with those. There's no comprehensive source. So some of the drug makers have pieces of that. There's no source you can go to as a consumer or even physicians that can go to that's comprehensive on that. So what is that? It's a big piece of curated information content. This kind of stuff librarians do, right? So they're doing this, and they've got it. And now they said, well, we sort of figured out, we've done all the curation, but how do we deliver that? How do we get it to people? How do we do ongoing collaborative curation? Those are challenges, right? These are things that we're trying to figure out how to tell them how to do, and I think you guys know a lot about. So they're actively building that. We're building them a prototype, so what do we make? A database, a web front end. But what we're thinking about is what the interface is, right? How do they interact with it? How do they do collaborative curation? How do we push this out to different audiences? Let's see. I think I've hit most all of them. The last one I was going to do, my student was supposed to bring my Google Glass back to me. I was going to bring my Google Glass and put them on, but he didn't get them in before I walked over here. So I'm kind of hosting a group on campus for Google Glass research. I'm very excited. The library actually has several Google Glasses. And we see this wearable kind of computing, but especially things that use the visual. David and I are both very visualization kinds of types of researchers. As ways that people are going to be interacting with information in the future, ways to change their behavior. So we've started to play with some of these things, telemedicine, recording surgery, we can let people share stuff, or if Fran's the expert in skin cancer, and I'm in Siler City and I don't know so much, I'm a family practice doc, I can take the picture, she can see it in the Google Glass, we can refer, and like that we have an answer, a more expert answer than we had before. All kinds of applications you can do with glasses that show you visuals. It makes it hands-free and allows kind of more communication, which is really good with working with patients at the physician. My son's going to go to med school, and he was in EMT this last year. And actually, one of the areas we were playing with was EMTs, because they don't do that much work when they're out in the field. The physicians have to do most of it when they get back to the ER. But it would be kind of cool, we thought, if the EMT was wearing the glasses, right, and they could see back in the ER what was happening and give them a better update, and they might be able to guide the treatment a little better. I think you need to too. Right? Go ahead and do it in the field kind of thing. All kinds of decisions that you've got this collaboration, you're kind of seeing what they see, talking with them, that kind of collaboration live could allow. So, librarians know very well how to do these kinds of things. Managing information, curating information, outreach, how to create training materials, things like that. These are the kinds of things that people on campus need to know how to do, right? They have all this science data, need to reach out and communicate these messages. This is a huge, huge area. There's big data, all the text data processing we're going to do on it, all the ways we're going to interact with it. So I think I'll stop there and hopefully provide some seeds for you guys to bring up in the discussion time.